welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here is what I bring to you all from the world of medicine. Increased COPD risk for women due to smaller airways. Structural differences in lung airways between men and women may be the cause for differences in chronic obstructive pulmonary disease prevalence and outcomes between the sexes. For this study, researchers analyzed data from nearly 10,000 participants enrolled in Genetic Epidemiology of COPD or COPD Gene, a prospective multi-center observational cohort study of current and former smokers as well as never smokers between the ages of 45 and 80 years at 21 clinical centers across the US. The researchers looked at data of never, current, and former smokers enrolled in COPD Gene from January 2008 to June 2011 and followed up longitudinally until November 2020. Airway disease on CT was quantified using 7 metrics: airway wall thickness, wall area percent, pi 100 or square root of the wall thickness of a hypothetical airway with internal perimeter of 10 mm for airway wall, lumen, airway passage in which air flows through, diameter, airway volume, total airway count, and airway fractal dimension for airway lumen. Each airway metric was calculated and adjusted for age, height, race, body mass index, pack years of smoking, current smoking status, and total lung capacity. In 420 never smokers, CT scans revealed that men had thicker airway walls than women, whereas after accounting for height and total lung capacity, airway lumen dimensions were lower in women than in men. In 9,363 current and former smokers, men had greater wall thickness, whereas women had narrower segmental lumen diameter. A unit change in each of the airway metrics, that is higher wall or lumen lower measure, resulted in lower lung function, more dyspnea, shortness of breath, poorer respiratory quality of life, lower 6-minute walk distance, and worse survival in women compared to men. The researchers noted that the research implicates that sex differences should be factored into the development of new therapies for airway disease. The link between heart attack, stroke, and gout flare-ups. Experts at the University of Nottingham, in collaboration with experts at Keele University, have found the risk of heart attacks and strokes temporarily increases in the 4 months after a gout flare. The results of the study, led by Professor Abhishek in the School of Medicine at the University of Nottingham, are published in the journal JAMA. The team used anonymized data from 62,574 patients with gout treated in the National Health Services in the UK. Of these, 10,475 experienced heart attack or stroke after the diagnosis of gout, while others of similar age, sex, and duration of gout did not experience such events. They evaluated the association between heart attacks or strokes and recent gout flares and adjusted these results for comorbidities, socioeconomic deprivation, lifestyle factors, and prescribed medications, among other things. They found that gout patients who suffered a heart attack or stroke were twice as likely to have a gout flare in the 60 days prior to the event and 1.5 times more likely to have a gout flare in the preceding 61 to 120 days. They found a similar high rate of heart attack or stroke in the 0 to 60 and 61 to 120 days after gout flares compared with other time periods when they used information from only patients who consulted for a gout flare and also experienced either heart attack or stroke. This further strengthened the finding that gout flares are associated with a transient increase in cardiovascular events following flares. Gout patients who died from a heart attack or stroke had over 4 times the odds of experiencing a gout flare in the preceding 0 to 60 days and over twice the odds of gout flare in the preceding 61 to 120 days. People with gout should be encouraged to adopt a healthy lifestyle with appropriate treatment of conditions such as high blood pressure, high cholesterol, obesity, and diabetes to minimize their background risk of heart attack and stroke, the authors noted. An effective new treatment for chronic back pain targeting the nervous system. People challenged with chronic back pain have been given hope with a new treatment that focuses on Retraining How the Back and the Brain Communicate, a randomized controlled trial run by researchers at UNSW Sydney and Neuroscience Research Australia or NURA, and several other Australian and European universities, has shown. The study, carried out at NURA, divided 276 participants into two groups. One undertook a 12-week course of sensory motor retraining, and the other reviewed a 12-week course of sham treatments designed to control for placebo effects, which are common in low back pain trials. Professor James Macaulay from UNSW School of Health Sciences and NURA said sensory motor retraining alters how people think about their body in pain, how they process sensory information from their back, and how they move their back during activities. The new treatment challenges traditional treatments for chronic back pain, such as drugs and treatments that focus on the back, such as spinal manipulation, injections, surgery, and spinal cord stimulators, by viewing long-standing back pain as a modifiable problem of the nervous system rather than a disc, bone, or muscle problem. The treatment aims to achieve three goals. The first is to align patients' understanding with the latest scientific understanding about what causes chronic back pain. The second is to normalize the way the back and the brain communicate with each other. And thirdly, to gradually retrain the body and the brain back to a normal protection setting and a resumption of usual activities. Traditional therapies concentrate on fixing something in your back, injecting a disc, loosening up the joints, or strengthening the muscles. What makes sensory motor retraining different, according to Professor Macaulay, is that it looks at the whole system, what people think about their back, how the back and brain communicate, how the back is moved, as well as the fitness of the back. The link between persistent low wage and a faster memory decline in later life. Sustained low wages are associated with significantly faster memory decline, according to a new study by Columbia University Mailman School of Public Health. While low-wage jobs have been associated with health outcomes such as depressive symptoms, obesity, and hypertension, which are risk factors for cognitive aging, until now no prior studies has examined specific relationship between low wages during working years and later life cognitive functioning. Findings are published in the American Journal of Epidemiology. Research into the effects of lower income on health is rapidly expanding. Using records from the National Health and Retirement Study (HRS) of adults for the years 1992 to 2016, the researchers analyzed data from 2879 individuals born between 1936 and 1941. Low wage was defined as hourly wage lower than 2/3 of the federal median wage for the corresponding year. Kezios, who is the study's lead author, and colleagues categorized study participants' history of low wages into those who never earned low wages, intermittently earned low wages, or always earned low wages based on wages earned from 1992 to 2004, and then examined the relationship with memory decline over the next 12 years from 2004 to 2016. The researchers found that compared with workers never earning low wages, sustained low wage earners experienced significantly faster memory decline in older age. They experienced approximately one excess year of cognitive aging per a 10-year period. Senior author Adina Zeki Al-Hazuri noted that their findings suggest that social policies that enhance the financial well-being of low-wage workers may be especially beneficial for cognitive health. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.